Thank you so much for joining us. Today's title is The Next Chapter in 340B, Preparing for Success in 2024 and 2025. We have a really great agenda today that the team had a lot of fun working on. And we actually have a special guest, a new face on the show. We have Sarah James here from our pharmacy team, and she's going to be talking a little bit about some of our topics later on. And with that, I will pass it over to Anthony. We also, as you know, have Justin here as well. And I'll let you guys do your little shindig. But thank you so much for joining us all. If you want to, feel free to talk to us in the chat. We're reading it. Sarah, you've already got some hellos, so you've got some fans online with us. And any questions, put in the chat. I will be monitoring them, marking them, and we'll address the ones live that we can during today's session. We're also going to have a live poll for you later on, so get ready because we're going to make you do a thing. And with that, Anthony, I'll turn it over to you.
Yeah, so thank you everyone for joining. I need to let my co-host introduce himself because I know he gets a lot of praise as well for his comedic relief on this. So Justin, why don't you introduce yourself to everyone that may be joining us for the first time?
Hey everyone, Justin Rowling, Vice President of National Sales. I'm here at Thermal Force. Thank you all for joining. If you are a returning attendee, thanks for giving us your time every month. If you're new to this, we're glad to have you. This is a 30-minute webinar, 45 minutes with the Q&A, and Anthony will present the hot topics of what is relative to the 340B space, what we think is relative to the 340B space. We try to keep it 30 to 45 minutes, so we know you're all busy. We will take questions. You can put those in the chat or in the chat, and we'll address those after we get done with the presentation. But it's 30 minutes, 45 minutes, and thank you all again for joining, and all my new people, thanks for joining us for the first time. And I'll turn over to Anthony Velasquez.
All right, so we're going to bring in Sarah. She's going to have her own portion here in a few minutes here. But why don't we get right into it? Really appreciate you guys joining us today. For those of you that are joining us for the first time, my name is Anthony. I'm the Chief of Product here at PharmaForce. Been in the 340B space for going on 14, 15 years now. Had my background in working at a few health centers, hospitals, and now on the technology side of the third-party administrator. So I have that perspective of both having worked on the hospital side and the third-party administrator side. And we do these webinars once a month. We're looking at some other really cool things as we hear a lot of great feedback from everyone that joins in relationship to the content that we're sharing. So we're looking at maybe doing a little bit more, maybe doing a little podcast or some other things. So you'll see some things coming out from us over the next few weeks and few months. So let's go ahead and get started. 340B continues to change. Before I go into anything else, I have to provide this disclosure that nothing that I am going to say here should be constituted as legal advice. This is for general information purposes only, and only to be used from an educational perspective. So please don't vet everything that you are going to hear with your compliance team and your team. I think that's a responsible thing to do just because of where we are as well in the 340B space. All right, so got an agenda today of several things. So we're going to talk about selecting the right partners. So this is how do you prepare for success? I want to touch a little bit on what's going on with the Johnson & Johnson, the rebate model. I know that many of you who are covered entities and are dealing with the headaches of submitting to ESP and the Bristol Myers Squibb situation right now with requiring a data that you're not able to get your hands on and all that other stuff going on, just makes 340B a real headache. It's a really tough time to be part of the 340B program, to run the 340B program right now. One of the things that we want to do is we just want to say, hey, look, it's a really rough time to run a program, but it's even harder if you don't have certain pieces in play. And we really want to share some information that's going to really prepare you to really be successful, we've seen entities that really can have benefited from a reset of, having having a new TPA or a new wholesaler or a new contract pharmacy specialty partner, et cetera, that really has provided, sort of a brand new win to their 340B program. So that's what I'm hoping to accomplish today, is just that you walk out of here with a nugget of information on how to make your program better. And also, don't forget the basics. Don't forget that, there are things that as a 340B professional manager, coordinator, director, or if you're a director of pharmacy that's leading a 340B program at your covered entity, that these things are critical to do. All right, so selecting the right partners, implementing best practices into your 340B program, especially as it relates to data interfaces, expanding your pharmacy network. We're going to talk about that because in this world of manufacturer restrictions, you would think that there wouldn't be much contract pharmacy expansion, but I think you will find today that the opposite is true. We're going to talk about ESP and touch on that for a second, and then maximizing a referral capture program as well. So choosing the right partners. This is so important, so dear to my heart. I have been in situations on the 340B side where you are working with a third-party administrator, for example. You're locked into a 5-year, 6-year, 7-year contract of a relationship that you're not happy with. Your program is not going well. You're missing opportunities. You know that you're doing a lot of things manually, but unfortunately, you can't get out of the contract. You're stuck in that partnership. It feels yucky. It feels terrible. I know Justin hears about that all the time in conversations that he's having. So we'll bring him in a second. But that, I can't stress enough how important it is to choose the right third-party administrator. It is one of the most important decisions you can make as a covered entity. So if you're in the middle of an RFP, if you're going through a decision process, highly, highly encourage you to vet your third-party administrator well. Make sure that third-party administrator can provide the needs of your program, that there's someone that is innovative. Some of the things that are going on in the space, just to give you guys a little bit of insight, is there's some consolidations going on in this space. There's some third-party administrators that have actually given up on the 340B program and have fired their entire product teams and are not innovating and are not really listening to customers and really understanding where their pain points are to continue to get better, because we all have our pros and cons. I'm not here to pretend and say that PharmaForce is perfect. We all have our pros and cons as third-party administrators, but you want an administrator that's always working to getting better and not saying, hey, we're not going to invest in this market anymore. And some of that is going on, unfortunately, in our industry. That's not very apparent to covered entities because you're not in the know of the TPA world, but some of that's going on. There's some consolidations. There's some TPAs that have actually given up on really being in the space, and some of it is manufacturer restriction related and other things. But it's very important to find the right partner. I can't stress this enough. And I'm sure that if we ask the audience of stories of, hey, we're not going to say names. We're not here to bash anybody. And there are some TPAs that do a good job. We're not here to bash anyone. But there are covered entities that are hurting and their savings are being affected by not being a partner with the right third-party administrator. So that is, I would say, number one, it kind of starts there just because TPAs are such an important, critical part of the overall 340B program management. Justin, I'll ask you to see, what are you hearing? Just kind of like, I really want this to be like, let's give, the folks that are attending really good nuggets of information of like, what are you hearing out there? Why are people switching? I'm curious about that too. Like, what are you hearing are like the top 2 things why people are switching and looking for new services without going into it, Justin, right?
Oh man, you're limiting me. No, so what we hear is, so for years TPA, our 340B didn't change really. It was, it was the same old. And what we're hearing is their TPAs cannot keep up with what they, with the market, with the environment of 340B, just reports, those types of things. So they're switching because they don't feel like they have a TPA partner. They feel like they're just another customer. Their savings have gone down, and they have no help from their TPA how to get those savings back up. And then I think really it's customer service. When they're asking to make changes, it's taking a month, 2 months. They're putting in service tickets, And then once they get the answer to this, they say the service ticket's completed, it's not even what they asked for. They didn't understand what the CE was asking for. And how frustrating is that? How frustrating is it to have to wait 30 days to add a provider? That's what we get a lot all the time. They see our provider portal in our solution. They go, oh, I can just add them on the fly. Yeah, within 5 minutes. And they say, well, it takes 30 days sometimes for my TPA. And then they won't go back and reprocess. They charge them a fee for that. So that's kind of the frustration of, you have to have a TPA that can adapt quickly to these market changes, and the solution should react quickly to whatever changes the CE wants to make. And definitely the HRSA police, this is their program. So we have to facilitate the way that the customer wants it, facilitate it, not telling them what they can and can't do.
What they can, yeah, no, good points. I know I see someone in the chat saying there's no perfect TPA. That's 100% right. There is no perfect TPA. But you do want a TPA that cares, and you do want a TPA that's trying to get better. I think those are some important things to know. And a TPA that's going to, in general, be a good partner, with you in navigating these really complex times. Okay, so that's number one. Number two is contract pharmacy partners. It does matter who you choose to do a contract pharmacy relationship with. In some cases, it's the independent pharmacy in the rural town that's the only one in town. That's where your patients go, and it is on the entity to establish a good outreach and a good relationship. And I can't wait to get to Sarah's section because she has so much good insight into this. But a good relationship in a 340 in a contract pharmacy partnership can either make or break your program, whether it is on a national level with some of the big chains and specialties, or whether it is a independent pharmacy that you're working with hand in hand that needs a little bit more, concierge service, a little bit more touch, just because of, hey, this is, someone that lives in our community, is on the board of the hospital, et cetera. And those things all kind of play a role into there. Having a fair PSA agreement, considering things as will the pharmacy do credit-based replenishment? Those are all things that you want to bring up as you're considering a contract pharmacy partner that's going to help your 340B program continue to grow. All right, wholesalers. Wholesalers are another key player in this entire relationship. There are three main wholesalers in the market. I think they all have, they're good things, and they all have things that maybe they could do a little bit better. In general, you want to consider credit-based replenishment. You want to consider the service and support that you're getting. You want to consider that the wholesaler has a 340B driven component to ensure that they understand your challenges as a covered entity and can help you overcome that. Some of that conversation with wholesalers and doing credit and rebills and things like that can be difficult and can be complex. So you want a good partner in your wholesaler that understands the challenges of 340B and that you're going to work with. These are harder to change, right? TPA, a contract pharmacy relationship, those kind of fall in the scope of a 340B program manager. A wholesaler is sometimes a bigger decision across your system. If you're a grantee or something like that, maybe not, but in general, it is a bigger decision. The last one is consultants. And only if this is applicable to you, many of you that are on and join our webinars are consultants. Some are covered entities that you have your own 340B team. But if you are choosing a consultant, don't take that lightly. Make sure that you're checking references. Make sure that someone that uses that consultant. Make sure that consultant has a good reputation in the market and in the industry for being knowledgeable with your type of covered entity. That's a really important key. We're in a time where there are many consultants, there are many options for covered entities. You want to make sure that you're choosing the right partner for you that can help you really expand your 340B program.
And Anthony, if I could jump in there, just to say that like you said, there's some really great consultants out there, and there's such a huge boom to the covered entities they work with, because as a TPA, we can't do a lot of the things that covered entities need as far as outside of the scope of the TPA, right? And those consultants are so pivotal to helping covered entities manage their program compliance, expand their program, those types of things as well. So we love our consultant partners out there that help our covered entities. We work very closely with them.
Yeah, the entire wave of ESP and manufacturer submission, claim submission, stuff like that, that has really opened the door for a lot of consultants. I'm seeing a lot of dependency on consultants to help with that. So, okay, cool. The next topic is data. What are the best practices on data interfaces? Each of these things that I'm sharing could be a webinar on its own. So we really try to not be repetitive, to provide new content, fresh content every time that we do these monthly webinars. So we're giving a high level. There's obviously a lot deeper details that we can go with some of these things, but I want to leave you with a couple of messages here. Number one is clean data is key to a successful program. Those of you that have worked in the hospital IT world, you would know the phrase garbage in, garbage out, and that's exactly what applies in our space, in a 340B contract pharmacy relationship, and a 340B, TPA relationship. That same logic applies. I'm going to share, sort of three main things. One of them, I'm going to give you sort of some insight on something that's going on in the industry right now. But one of the things that is really important is, how does your covered entity handle encounters, e-prescriptions, or RX orders is what I have here, and your providers. I'll mention for the encounter and prescription orders that some of the filters that are not considered when a covered entity is implementing. So this is a sort of a best practice, but it's not considered in general or at times. Let me be more specific. At times, this is not considered, and that is, hey, do you have multiple electronic medical records where you might need to pull data from EMR1, pull data from EMR2? You might have a report writer that needs to pull in eligible locations only, or needs to pull in eligible encounter types. So we've seen some of that. I'm having a little issues with my camera, so I hope you guys don't mind. But I'll just keep kind of going with the flow. But there's report writers that need to consider: am I sending all the eligible encounters for the covered entity from the EMR records? I've seen situations where entities are sending data, and what they're sending are in the encounter type. They're not excluding things like radiology visits. They're not including things like vaccines. They're not including things that will not, phlebotomy visits that will not lead to an eligible encounter, and some of that can lead to false 340B capture results. So you want to pay attention to these things. These are some of the, I would say, if you just focus on these three, you'll avoid a lot of issues. Making sure that you're including all your EMRs, all your locations. Make sure that you are vetting each location that is being sent in your report, and that you are including the right encounter locations as well. Okay, next is switch claims. This is something that is happening recently in the market. Some of you might be dealing with this right now, but there is an issue that we're discovering, that certain switches are not transmitting all of the data to the third-party administrator. So if I don't know if many of you or any of you have faced this challenge, but one of the things that we're seeing is a change, a move from entities considering, should I send my claim switch, my data from the switch, or should I get my pharmacy management system to submit that claim switch data, or should I have my report writer submit that data directly to the third-party administrator? Right now, it's a pain point. What we're seeing is some of the reversals are not coming through, so the entity is seeing more accumulation than they should. We have instances where cash claims that are not adjudicated are also not coming through in some relationships. So we're having entities moving to a direct process where they're doing a direct feed. Especially their entity owned or an in-house pharmacy, they're pulling that data on their own, and then they are providing that data to their third-party administrator. So I'm curious to know if that's something that anyone on this line has seen as an issue. But we are hearing sort of reports of entities being very frustrated with their pharmacy management system, and sort of we've seen that progression of, I'll start with the switch. Oh wait, why are my cash claims missing? And when I say cash claims, I'm not talking about things that go through a cash card plane, just things that are cashed directly things that are sort of like transmitted or not adjudicated, but they're adjudicated only in the pharmacy management system. So so if you're facing that issue, maybe you're not in the weeds enough to see that, but that is an issue that we have seen. Automate your data, avoid manual submission. This was a thing at time. I saw someone post in the chat, which is like really great point, is that yes, there are pharmacies that have multiple switches. There are time that you need to connect to both switches so that if one switch goes down and the other one is up, that data is transmitted to your TPA. So beware of that. Beware of that. We saw that with the Change Healthcare situation where a lot of people had to change switches at the time, and it led to some data issues. All right, number 3, good data review. One of the things that I said is, if you are managing a 340B program, you're a leader in a 340B entity, a report writer is such a key player in ensuring that you have good data going to all your TPAs, especially if you have a complex program that has a TPA relationship with Walgreens, a TPA relationship with CVS, a TPA relationship with an independent third-party administrator like PharmaForce or something like that. You want to have a good report writer that can make all the difference in you having a good, clean program that runs like a well-oiled machine, or a program that has a lot of interfaces data issues. So audit your interfaces. If you haven't audited your interfaces and you're been in your 340B program, for example, and you've been in your role for 5 years and you've been managing your program, you're putting out a fire every day, don't forget to do something simple like, hey, let me work with the IT team, just audit our interfaces and see that if we open new locations, if they're going over, if we have the right encounter types, etc. You could really find some good nuggets of information in that data. All right, so Sarah, you're up. Get ready. All right, so believe it or not, Sarah, who she'll introduce herself in a second, Sarah's our pharmacy network lead. And one of the things that we are seeing is, and more recently too, just entities continue to expand their network. And I'm going to ask Sarah a couple of questions as to why she thinks that is happening, for her to give us some insight and tips. But we're seeing some of that. And Sarah, my first question to you is, why don't you introduce yourself to everyone on here, and then just go right into it. What is a pharmacy network lead? Like, what does that even mean, and what do you do?
Okay, so I'm Sarah James, and I'm part of the pharmacy network team lead. And I've been with PharmaForce for just over 2 years. Prior to this position, I was in the account management setting. And with this position, hang on, I'm going to take these off.
Yeah, go for it. We can hear you fine, by the way. We can hear you fine. It sounds a little bit far, but we can hear you.
Okay, sorry about that. There was a big echo in my ear.
Yeah.
So I was part of the account management team prior to this, and with this new role for pharmacy network lead, what we do is we actually work with covered entities to help expand their pharmacy networks. We also work with new 340B CEs that we've recently signed in trying to get a better feel for growing their program and really digging into where they have potential for growth.
Okay. All right. So my first question is, I've been talking for months about manufacturer restrictions, right? And we know for a fact that many of our entities are hurting and not able to, missing out on, hundreds of thousands, if not millions of dollars of claims captured because of the manufacturer restriction. So help us understand, how are you still seeing growth despite, like, what are those things that are still leading to growth in, pharmacy network expansion, even though many entities are facing this manufacturer restriction issue?
So recently, I want to say in the first quarter when I first started with this, we were seeing a lot of specialties, and I think that a lot of CEs are still looking into specialty pharmacies to help grow their program because they can really utilize some of the referrals and also specialty claims that are just out there waiting for capture. We've also noticed that the covered entities are still looking to expand because they may also have pharmacies that they're not currently utilizing that may be using a lot of their claims. So they may need to change their restrictions. You can also, with some of the new restrictions being lifted, it has cause for more covered entities to kind of look deeper into their program to see if there is potential for growth still.
Yeah, so maybe when you're saying lift it, you're talking about specifically the state level bills. So the contract pharmacy access bills that we have seen in the state. So if you're in a state like Arkansas, you're not as affected as my home state of Pennsylvania, that unfortunately does not have a contract pharmacy access bill, but your home state, has one. So the entities in those states are seeing, still the ability to sort of run their program a little bit close to normal, right? Where like, many entities across the country, it's a whole new world for them. And even if you're in those states, you still have some ESP submission in some cases, right? Because everything varies. But okay, so let's turn into what can covered entities do to be successful in network expansion, and then get the poll ready, Hannah, because we're going to do this poll to see who has done this. But Sarah, what can covered entities do, or what are you seeing are good practices or best practices, of how to expand a contract pharmacy network?
So something that we've been using more often lately is if the covered entity can pull their e-prescription records from their EMR. Typically, we will say the last 3 months, and then we can we can dive deeper into those claims to best determine where those claims are being filled and what pharmacies might benefit from that, or what pharmacies the CEU would benefit from. What we've seen is that some of them are contracting with certain independent pharmacies, but they still have a huge opportunity for specialty, or even have more opportunity at a different independent pharmacy. So what we will do is we'll pull that analysis together and kind of dig deep into that, and then kind of go over everything with the CE. If you are not able to pull the EMR data, then what we will ask is have an updated NPI list, and if you're wanting specialty, to have referrals if you have that available. And then we will actually reach out to those pharmacies to get a better, to get connected, and then also request for those claims volume. Lately, what we've seen with specialty pharmacies and also chain pharmacies, they've added an extra step in their analysis where they're providing not only manufacturer included, and then also an analysis where they remove all of the manufacturer blocks. Sometimes it is specific for your CE, or in some cases, the specialty pharmacy or chain pharmacy will just remove all blocks. So you have a better view of what you're really looking at and what your potential is.
Gotcha. Okay. So entities are giving you the e-prescription data. You're reviewing that. You're determining, what pharmacies or prescribers are prescribing to. I know we talked about the referrals, where the referrals is not always as clear, where referral prescriptions are going. So you're able to get that information once you get the providers from the entity. If they can provide that, it's very difficult to do at times, but if they can, and then you're submitting that to the pharmacies to provide that opportunity. All right. So with that being said, can we run our poll? I want to run our poll and see, is this a part of, your normal sort of, program management? So those of you that are on the call, if you have done what we're seeing, what we're seeing, and let's see if the numbers trend this way. But what we're seeing is, Sarah has shared with me that, Sarah, you said, I think on an 8 out of 10 CEs that you talk to, there's some opportunity to do network expansion, and some there isn't, right?
Yes, whether it's with referrals, adding referrals, or just adding a new pharmacy, or kind of reevaluating the pharmacies that you currently have, and maybe there's a different pharmacy that should be being utilized instead of the current one.
Yeah. So Sarah, our initial results are 58%, 59% say yes, they have done a pharmacy network expansion analysis in the 8-year, and in the last year, 43%, 44% say no, they have not. So if you're in the 44% that has not done a pharmacy network analysis, reach out to your your third-party administrator that you currently work with, or reach out to us, and we can probably help you and at least guide you the right way in how to do this. But you definitely want to do that, especially if you are in a state that has a contract pharmacy access bill. This is an area that you want to be doing especially in the specialty world. If your TPA has the knowledge to understand that referral providers in the specialty space as it relates to and knows how to do that pharmacy network expansion analysis, including that can be key to unlocking a lot of savings and opportunity. Sarah, thank you so much for that. And I hope you all found Sarah's knowledge, as she's doing this every day and adding hundreds and hundreds of pharmacies for entities. All right, cool. So let's go to the next topic of mastering data submission. So this is the new world of 340B. And as far as we know, it's here to stay, and it's only getting worse in some cases. So
by worse, you mean more exciting, right, Anthony?
Yeah.
Anything every day.
Yeah, it's almost feel like it is daily. There's some sort of like, such and such manufacturer sent out a new update that now it's this NDC, and you can only these states are exempt, and there are now multiple letters. And I kind of shared an example of what that looked like, but a couple
340B on your toes.
What was that?
340B on your toes. Did you know that? That's what the B stands for.
Yeah. So all right, so we have this sort of like new breaking. So there's breaking news of this Johnson & Johnson thing, and some of you might know of it. I mean, it's pretty out there, of Johnson & Johnson being the first to announce on August 23rd this new rebate model. Okay, so this is a complete change to the way 340B is done. Our VP of marketing, who's very who likes to is in a joking mood, has our not very cutesy, not very mindful, not very demure.
Sarah gets it. She's laughing over there.
Sarah, she forced me to keep it in. I didn't really want to keep it in. But on a serious note, this is going into effect October the 15th. So on October the 15th, if you are a dish hospital, this is going into effect so that for these two products, you will lose 340B pricing. It will not be available on a 340B catalog any longer. Instead, you will have to purchase the product at a WAC pricing or a retail-like pricing. If it's even added to your catalog, we've yet to see how wholesalers are going to respond to that. And then what's going to happen is you have to submit claims and supporting purchasing data to this platform called Beacon, that is who Johnson & Johnson is partnering with, and then they will give you they'll send you a check or send you some sort of money, for the difference, right? So, so that has, that sort of came out. Then what we heard is sort of, news that HRSA, which, very, very supportive of HRSA, applaud HRSA for this. HRSA came out and said, hey, we are going to impose monetary penalties. We're going to remove access from Medicaid and Medicare if you don't retract this rebate model. And I mean, I think this is the first threat that actually has strong teeth to it. And again, I commend HRSA for doing something like this, because I think it is warranted, given the change that Johnson & Johnson is proposing, that we know would start just like ESP with one manufacturer, and as soon as they get a little bit of an itch, then every manufacturer will move to a model like this. So I'm in support of HRSA doing this. We commend HRSA. I saw in the chat it's just a rumor. It is not verified by me, but I saw in the chat that Johnson & Johnson may be backing away. Thank you for whoever shared that scoop in the chat. There's Kim in the chat sharing that scoop. So Kim, thank you. I hope it is correct. I have not verified that personally. I'm sharing, what is being shared here in the chat real time. So I hope that we just got some like real time breaking news, because this is ESP looks very easy compared to this rebate model. So, so hopefully this is not true. Okay, now let's go into the meat and potatoes of what are the best practices for a successful ESP management program. So if you are exempt in your state, it can be a little less challenging, but still, probably the same level of work. And what I mean a little bit less challenging is that you have pricing, on more products. So you have pricing on more products because certain manufacturers have said, we are not going to apply this exemption to the state of Arkansas, West Virginia, Missouri, and some others, whatever the 8 are, which I can't remember right now off the top of my head. But if the submission is required and you're doing any type of ESP submission, it is so painful. I'm hearing entities that are spending 10 to 20 hours a week just fighting with ESP when they're reviewing their negative balances and submitting the proof of like, I submitted that. Why are you threatening to take my pricing away? And they do take the pricing away. And they have to go on this back and forth. They don't reply. If they reach out to the manufacturer, they don't get responses. So it is super painful to be a covered entity right now submitting to ESP. We're hearing reports. I don't know if, those of you that are on the line are aware of this, but BMS specifically of the manufacturers now telling entities that they require the product serialization that is supposed to be provided with track and trace that hasn't even gone into effect. All right. So Justin, I don't know if you heard this, but BMS is saying, if you don't submit this product serial number, we're not going to accept the data, the claims data at all on the ESP portal. So you're going to lose pricing, right? And then, the entities are like, okay, yeah, well, okay, tell me, where do I get the data, right? So they call the wholesaler say, oh, well, we're not ready to send that to your TPA, right? So, they go to the TPA and the TPA says, hey, we don't have that data. And the entities are stuck in the loop of bureaucracy because the manufacturers are doing this on purpose, in a sense. So anyway, this is sort of where we're at. Justin, I don't know if you heard that. If you want to jump in for a few seconds here.
I did, and it was a rumor was that BMS had been asking questions for a year to figure out how they could pigeonhole the covered entities into submitting data they can't have that they can't get currently. So that it was smart by them. But also, I do applaud HRSA's stance on the J&J stuff. And you guys were doing a meme earlier. How about the meme? All right, now do contract pharmacy. Because, if that would have been the stance from the get-go in 2020, we probably wouldn't be here if J&J's backing off on this one. Telling them they can't participate in the federal programs anymore is a really good way to kind of stop the manufacturer piece.
I'm surprised too, because the like I said, that has teeth, right?
Exactly.
Yeah, that has teeth to it.
Right.
That will hurt them more, than the 340B program, I think.
Right. 340B is what, 3 to 5% based off what they say. That would be detrimental. In the 50% or whatever it is range. And so, yes, that should have been the stance in 2020, and that I'm glad that was the stance now. Maybe we can, if that works, they can go back and say the same thing. Okay, for manufacturer restrictions, stop now, or you can't be in the federal program anymore.
Right. And hopefully that is the case, and I agree with you. All right, so yes, I'm seeing some other reports about BMS as well. Yeah, I heard that too. That some TPAs are just blocking BMS across the board too because of this too. I wish I had a better answer than to say like entities are really stuck in the middle of this whole debacle. Unfortunately, the product serialization number is not easy to find. I have been working with covered entities like as recent as this morning of trying to find, all right, so, who has it? Who can provide it? Wholesalers saying, well, entities should be able to access the wholesaler. I've not been able to verify that is available so that it can be added to the claims file for submission. So if we find something out on that, we can resolve that. I think we should do a webinar on that because it seems like a very, very, very painful thing that entities are facing right now.
Agreed. I saw a great comment by one of our guests. It's a great move for BMS to be able to save money if it's just for 6 months, if it's just for a year.
Right.
Because that's all. Because they're not let you go back. That's always the case, right?
Right.
45 days. Like on the ESP stuff. So how does that help you? And so it's just another way to increase stock price for 2024. And they have millions upon millions of dollars to just spend on their legal team, and they have some really smart lawyers. That's the way of capitalism in a way, right? That you're going to keep fighting to get every edge you can. So you can't blame them to an extent for that piece of it. But if a strong oversight, a strong federal statement from HRSA is all it takes.
Well, I hope it's not just a statement. Like, I hope they really meant it because, entities are hurting. Entities have been asking HRSA to to bring a little bit more strength, a little bit more teeth. So I'm glad to see that. If you are struggling with ESP, I'll be honest, I'm not going to be able to fix that for you, like in this webinar, other than to help you, give you some guided steps on like, hey, make sure that you have an SOP on that, right? Make sure that you have a cheat sheet that you know how your entity in Arkansas, in Pennsylvania, in Florida, in Texas, et cetera, is handling or submitting or not submitting claims to the 340B ESP portal. If you're having to pull that data from multiple TPAs, make sure that you're consolidating that, maybe creating some sort of database where you're keeping that, you're keeping that stuff together for your own records and keeping those records of files that you're submitting, understanding the submission requirements. I know we have entities who right now we're working with to separate the BMS claims from all the other manufacturer claim submissions so that their files don't get rejected. Monitor your negative balances. That's a big one that I'm hearing, that if you don't monitor your regular balances, your negative balances in ESP, you lose pricing. If you don't push back and say, hey, wait, I submitted that claims data, and then monitor whether you're getting 340B pricing. That's easier said than done. I'm hoping to provide some help there with some product ideas and product enhancements that we're working on right now on how to help entities better monitor their 340B pricing, better monitor and handle their claim submission. So, all right. So that being said, we're almost done. We got a few minutes, but as you're preparing for success, most successful 340B programs that are optimized for capturing the savings that they are available to them have a referral capture process in place. So I know you probably heard me talk about this, and you probably heard this talk of referrals a million times, and maybe all of you that are on this call have a referral program in place. But I do want to state how critical it is that you have either the tools or the resources. Sometimes we have entities who say, hey, look, I have access to the data, I just don't have the resources, or I have the resources, but I need, a tool, and I need a technology platform that, that helps with, managing this and processing this. So if you have the tools and the resources to do this, then, I've laid out sort of like what are, the step-by-step that you can put into play to, review those claims, capture those claims, considering it is a very time-consuming process and can be a very time-consuming process, and you might even need dedicated service and dedicated resources to this. If you don't have that, then there are vendors in the market that can assist and consult on doing this on your behalf and giving you sort of a white glove service. That is something that we provide to our customers, because we see this as a huge opportunity for entities to capture additional 340B savings. All right, I'm going to be respectful of everyone's time. As we said, we're going to be 45 minutes. So I am done. This is it. This is the end of
dramatic ending, Anthony.
I'm done. I'm dropping the mic. My camera doesn't work. I don't want to touch it because it would drop. But oh, look at that! Look at that. We have Michael who said, "Look at Michael." Michael said, "I've emailed BMS 5 times over 7 business days, no reply." Michael, I've heard that a lot too. I've heard that from other people. So yeah.
Call your senators. Tell them to support the 340B Patients Act.
Yeah. Go ahead, Hannah. What were you going to say? Were you going to ask a question?
Yeah, 2 quick things. We had a few requests for the PDF of the handout. Do you want me to upload the PDF to this?
Sure, that's fine.
Okay. Yep. All right, I'm going to upload the PDF, so you'll see a handouts tab pop up. And then the second one is, Anthony, I don't know if you saw this, but we had a request to run a second poll. So we ran it while you were talking.
Yeah.
About contract pharmacy contractions or reductions over that same time frame. And it looks like it's about 50-50. It keeps going back and forth. Any thoughts on that?
Interesting. Yeah. I mean, yeah, what sucks is maybe some of these have had to do like a reduction in contract pharmacies, but then the contract pharmacy access bill passes. So then they have to go back and do it again, or, they're in a state where unfortunately they're not able to do that and don't have access to that. So that's also, unfortunate. But I mean, yeah, that's huge that 50% of covered entities on this webinar alone has said I had to reduce my contract pharmacy network. That means that less of your patients have access to pharmacies closer to their homes because of this manufacturer restriction in a major way. Is sad to see. And again, I wish there was a way to advocate to HRSA of like, yes, use that. Like tell them they're going to, that the manufacturers will suffer some real consequences if they continue to change the 340B program in a way that's beneficial to them and in a way that is that hurts entities and patients.
Okay. Well, I think we're just about at time here. There's a few in-audience questions about getting certain data from certain pharmacies and such, but I think we can follow up on that later, Anthony, unless you want to answer that live. Okay.
Yeah, sure.
All right. Well, thank you everybody so much for joining us. Justin, any final thoughts? Sarah, any final thoughts?
No, thank you all.
If anybody that's one of our clients is into looking for expansion, please don't hesitate to reach out to us. If we just want to do a reanalysis of what you currently have, please reach out to us whenever you can.
Okay. Well, thank you everybody for joining us. Be on the lookout for next month's webinar. And also, if you're still hanging on the chat, I would love to know if we set up a recurring webinar time and day that you would automatically be enrolled for every month. Would that be interesting, or do you prefer to enroll webinar by webinar? Let me know in the chat. It's something that we can do on our end, but I'm not sure what the appetite is for it. So, all right, looks like you're pretty popular, Anthony. I haven't seen. We got a giant ass Justin too. All right, cool. We'll have some cool things coming up. We're going to start adding to Justin and Anthony's voices on the show, as I'm going to call it. So today we've got Sarah. You might hear from our chief operating officer on one of these calls, as well as we're going to bring in third-party consultants. So we're going to try to add some more dynamic viewpoints to the show as we go on, but we'll definitely have a tight grip on the quality control, because the mastermind behind this is all Anthony. So every month him and I have a topic meeting and we go back and forth on, does this sound cool? Does that sound cool? So if there's anything that you would like us to talk about, also feel free to email in or suggest that in the chat. If there's any topics that you would love to hear a webinar on, we're always open to ideas as well. So,
yeah, thank you so much. Thank you, everyone.
Yeah,
thank you.